Hey everybody, Will Martin, family nurse practitioner in emergency medicine. So I've got an issue with the melt blown plastic masks that we wear. Those are the blue masks that they kind of feel like fabric, but they're not. They're actually plastic. And when I wear those, after wearing them for about an hour, the little bit of stubble that I get starts to wear on the inside of the mask, and then I feel like I'm inhaling particles of that mask. And I don't think I'm crazy, but I started to feel that way back in the beginning of the pandemic when we had to wear those masks 24/7. And I came across an article. It was published in China. It was actually a preprint in early 2020 that spoke of just what I'm talking about here, which is inhaling plastic particles shedding from your mask. Well, that preprint actually was published in the Journal of Environmental Pollution. And so I want to share that with you, and you might want to look it up yourself and take a look at this. But what they're talking about here is the melt blown plastic mask that we wear. And they took those masks and they did some tests on them. They looked at them under an electron microscope and they see that there's just tons of loose particulate on the inside of these masks that no doubt we inhale. And if you're inhaling a plastic particulate, how far down in the lung is it going to go? I mean, it's probably going to go down to the alveolar level. I don't know. And as far as I know, I don't think anyone's studying this. The one thing, interestingly, that is being studied, it seems, is the effect of masks on the environment once they're shedded. Once you're done with it, and the mask winds up in a landfill or somewhere else, there's a lot of studies being done on how that's affecting fish and wildlife and water quality. But my question is, how is it affecting the wearer prior to removing it? And I know that, I work 10 or 12 or sometimes 14-hour shifts, and I try to grab a handful of those masks when I come into work in the morning, because I know that after wearing it for 2 or 3 hours, that mask is probably shedding a lot of stuff and I'm breathing it in and I can almost feel it. So I change those masks pretty often, but especially early in the pandemic when we didn't have that many of those masks, we had to wear that same mask for the entire day, for the entire 12-hour, 14-hour day. And the only time that you would take that off is if you were going to wear an N95. So you would wear your N95 and then you would go back to wearing the melt blown plastic mask. So I've always had this concern that we're probably doing some damage to ourselves by wearing the mask. Now, of course, the argument is, well, what's worse, the coronavirus or the mask particulate? And the answer is, I don't think anybody knows. Or if they do know, they're not saying and they're not publishing it. But the point is, I don't think what we're doing is necessarily benign. And I would like to see some research done. But, here's the thing. I can't bring this up to the folks that I work with. I can't bring it up to the hospital because I would probably be gone the next day. They don't want to deal with someone who's asking the question of, is this mask harmful? Anyway, I think this is one article that you should read and tell me what you think about it. Tell me what you think or how you feel about wearing a mask all day. Does it seem to affect you? I mean, after I've worn masks for like 3 days straight, on that fourth day, if I have the day off, I just feel congested. I have a runny nose. It lasts for maybe the day and then it's gone. And I think it's really related to the mask itself. So, and I'm not an anti-vaxxer. I've said this before and I'll say it every time. I was vaccinated on the first day that vaccines were available back in December. And I also just received my booster and my flu shot on the same day and had no problems with it. And I believe that in the short term anyway, I think the vaccine is helpful. I think it's effective. Patients that I'm seeing that are really, really sick are unvaccinated. People who are maybe a little sick, but probably well enough to go home from the emergency department are also vaccinated. So I think the vaccine, at least in the short term, is helpful. I think we'll know a lot more in 5 years. I think we'll know a lot more in 10 years if anyone's willing to be honest about it. But tell me what you think about the masks, because I think we're going to look back on this in a few years and we're going to realize that maybe there should have been the opportunity to wear, I don't know, maybe cloth masks or cotton masks or something like that. I don't know. But worth thinking about anyway. Okay? All right. I'll talk to you soon. Thanks for listening.